Hopefully this will stimulate some further discussion here. So the treatment challenges, we'll get right to it. There's small, odd-shaped bones. There's overlap in your imaging, making diagnosis challenging. Oftentimes there's poor imaging because the deformities, there's poor vascularity, minimal soft tissue envelope, low tolerance for incongruity in this area. They're rarely isolated and high energy injuries, and we need to make sure we restore our column length. And they're an extremely broad range of injuries, looking from isolated sports, high energy, polytraumatized, as well as globally unstable. To start out, we want to make sure that we avoid soft tissue complications. So if you see films like this, you got to figure out where that is. And more importantly, you need to put that back somewhere, because if you leave that, what will happen is you'll end up with a spot like this that will ultimately go on to pressure necrosis, particularly if this gets put in a splint. They put an ACE wrap over the top and they sent your office a week later. You know, there's times where that patient will come in and you're looking at exposed tendon and bone, which is a real problem. So this is an example of a guy, motorcycle accident, severe midfoot injury. You can see the difference in the length of his foot and width of his foot. And that's because the column length has been markedly affected by the injury. We need to restore that. And that's best done with an external fixer. Same concepts essentially that Andy spoke of earlier. This is just a frame that I'll use often for these foot injuries. A transcalcaneal pin, a pin in the first metatarsal, and then an oblique pin. And I'd like to put that obliquely paralleling the 4 or 5 cuboid articulation, because those bones are small. And sometimes you have to put a tremendous amount of force to restore the lateral column. And you can get 6 cortices with that pin. I've seen this frame break the 5th metatarsal or 4th metatarsal base in certain scenarios. So you want to make sure you get good purchase there. And then you can just stretch them out to maintain your length and get those bony fragments back where they go. And while you do that, you can wait.